Welcome back, everyone. It's 6:20. Breast cancer is the most common type of cancer in women in the United States. The American Cancer Society estimates 1 in every 8 women will get it. 1 in every 35 will die from it. But there are some things you can do to lower your risk, and Dr. Ronald Downs is here to reveal what's fact and what's fiction about breast cancer prevention in this week's Health and Beauty Breakdowns. Good morning, Dr. Downs.
Good morning.
This is such important and timely information. October Breast Cancer Awareness Month. And I think a lot of people, unfortunately, are believing these myths about breast cancer.
And they have a lot of questions with regard to what's the truth. For instance, we get questions such as, can physical exercise help reduce the risk of breast cancer? And it absolutely can. We know that physical exercise pumps up the immune system. The immune system is important. It lowers estrogen levels. So we know that at least 4 hours of exercise a week will definitely help us reduce the risk of breast cancer. Another one, can healthy diet reduce the risk of breast cancer? A diet, we know, a nutritious diet rich in healthy fruits and vegetables definitely lower risk for breast cancer and estrogen levels. Now, a high-fat diet's bad because high fat stimulates estrogen production, and that fuels tumor growth.
And you see some of these diets from other countries, and you know that they're, as a whole, their country has lower breast cancer rates. So you can maybe emulate some of those diets and try to be healthier.
That's right. Smoking is another big problem. Now, there's no direct link between smoking and breast cancer. We don't have a scientific link. However, we do know that there are a lot of associated health risks with smoking, which can definitely reduce survival rates.
And if it's not breast cancer, it's maybe another type of cancer. So just a good idea to quit smoking and don't start if you're at all tempted.
Alcohol, smoking and alcohol, they kind of go together. Drinking alcohol, we know 1 to 2 drinks a day have been shown to increase the risk of breast cancer.
Really?
And that risk goes up with consumption. So the more you drink, the more you're going to increase the risk of breast cancer.
You know, you hear so much about wine, and red wines in particular, being healthy for heart disease, but you need to keep it in moderation, right?
That's correct. And when we talk about drinks, we're talking about 1 ounce of alcohol. And sometimes the content in wine's a little bit less, and then you're also getting the antioxidant effects from some of the red wine. So there's a little bit of a balance there. But overall, you really need to moderate your consumption of alcohol. Oral contraception, that's a big one. We know that oral contraception, especially in women under the age of 35, can increase your risk of breast cancer, and if you've been taking them for more than 10 years, it definitely goes up.
Wow, and there were some studies about ovarian cancer, how it would reduce the risk, but you've got to weigh those benefits, and if you have a strong family history.
You have to look at family history. Again, we talk about mothers, sisters, aunts, grandmothers who have had breast cancer, and again, getting mammograms every year. Stress, another thing a lot of people ask for. I live a very stressful life. Did that help me get breast cancer? Well, we don't have a direct link between stress, cause and effect link between stress and breast cancer. We know that stressful events have been shown to affect our immune system. So there's a lot of good studies underway currently that are looking at stress reduction in terms of boosting up our immune response and maybe helping slow up the progression of the disease.
And it could be as easy as relaxing, getting enough rest. Those can reduce your stress levels as well.
But I think the important thing to remember with this is to see your doctor regularly. You really need to see your doctor annually.
How many times?
Well, it's recommended that you get a mammogram if you're over the age of 40. You get a mammogram annually and also see your physician. But if you start to develop symptoms, something you don't understand, or a change in the way your breast looks or feel, see your doctor immediately, because that's going to be the most important thing with this. And we're lucky in Michiana because we have a lot of good physicians that can really help. There's a team approach to breast cancer in Michiana. People that are involved are your family doctors, your general surgeons, oncologists, radiologists, and plastic surgeons. They all get together as a team to help treat this disease. And the 3 things to remember is education, access, and I know I have 3 things. Education, access, and the team approach. And that's the thing I really want to emphasize, is the team approach to this is going to be very, very helpful in terms of combating this disease that affects 1 out of 8 women.
And we're going to continue to help people in that battle. So, again, go to our website, WNDU.com, and especially if you have ideas for future breakdowns on health and beauty subjects, give them to us here at WNDU.com. Thanks so much, Dr.